Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is one of the most common cancers affecting women worldwide but is highly preventable and treatable when detected early. Causes. The primary cause of cervical cancer is persistent infection with certain strains of human papillomavirus HPV, particularly HPV types 16 and 18, which are responsible for the majority of cases. HPV is a sexually transmitted virus, and while many people are infected with HPV at some point in their lives, most infections resolve on their own without causing harm. However, in some cases, the infection persists and can lead to the development of cervical cancer. Risk factors. HPV infection. The most significant risk factor for cervical cancer. Multiple sexual partners increases the likelihood of HPV exposure. Early sexual activity. Engaging in sexual activity at a young age increases risk. Smoking. Tobacco use is associated with an increased risk of cervical cancer. Weak immune system. Conditions like HIV/AIDS or medications that suppress the immune system can increase risk. Long-term use of oral contraceptives. Prolonged use of birth control pills has been linked to a higher risk. Multiple pregnancies. Women who have had many full-term pregnancies are at a higher risk. Symptoms in the early stages. Cervical cancer often produces no symptoms. As the disease progresses, symptoms may include vaginal bleeding, unusual bleeding, such as after intercourse, between periods, or after menopause. Pelvic pain, pain during intercourse or in the pelvic region. Vaginal discharge, watery, bloody, or foul-smelling discharge. Pain during urination, or difficulty urinating. Prevention. HPV vaccination. Vaccines like Gardasil and Cervarix protect against the high-risk strains of HPV that cause cervical cancer. Vaccination is recommended for girls and boys starting at ages 11 to 12. Regular screening, Pap smear tests, Pap tests and HPV tests can detect precancerous changes in the cervix. Regular screening is crucial for early detection. Safe sex practices. Using condoms and limiting the number of sexual partners can reduce the risk of HPV infection. Smoking cessation. Quitting smoking lowers the risk of cervical and other cancers. Diagnosis. Pap smear, a procedure where cells from the cervix are gently scraped away and examined for abnormal growth. HPV test. This test checks for the presence of high-risk HPV strains. Colposcopy. If abnormal cells are found, a colposcopy allows the doctor to examine the cervix more closely. Biopsy. During a colposcopy, a small sample of cervical tissue may be taken for further examination to confirm the diagnosis. Stages. Cervical cancer is staged from I to IV based on how far it has spread. Stage I. Cancer is confined to the cervix. Stage II. Cancer has spread beyond the cervix but not to the pelvic wall or lower third of the vagina. Stage II. Cancer has spread to the pelvic wall or lower third of the vagina, and may cause kidney problems. Stage IV. Cancer has spread to other parts of the body, such as the bladder, rectum, or distant organs. Treatment depends on the stage of the cancer and may include surgery, removal of the cancerous tissue, which may involve a hysterectomy removal of the uterus in more advanced cases. Radiation therapy uses high-energy rays to target and kill cancer cells. Often used in combination with surgery or chemotherapy. Chemotherapy uses drugs to kill cancer cells or stop them from growing. It may be used in conjunction with radiation therapy. Targeted therapy focuses on specific pathways or proteins in cancer cells to stop their growth. Prognosis. The prognosis for cervical cancer depends on the stage at which it is diagnosed. Early-stage cervical cancer is highly treatable and often curable. The 5-year survival rate is significantly higher when the disease is detected early. Follow-up care after treatment. Regular follow-up visits are important to monitor for any signs of recurrence and to manage any side effects from treatment. Cervical cancer is a largely preventable disease with the use of vaccination, regular screening, and safe sex practices. Early detection through regular pap smears and HPV testing is key to successful treatment.